Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, this is Dr. Jacobs. In this video, I'm gonna go over how you can treat your pain at home. Muscle, joint pain like back pain, sciatica, knee pain, hip pain, carpal tunnel, and so on. If you understand the normal healing cycle, it's gonna make a lot of sense that how you can relieve that pain at home. So briefly, our body has to go through 3 stages in order to heal. This is a normal healing cycle. I'm just gonna use external paper cut for visualization, but the same process happen internally from any accident, trauma, poor posture, poor body mechanic, any musculoskeletal issue. Your body has to go through those 3 stages in order to heal. If has not been healed, it's stuck in one or in 2 stages of the healing cycle. So the first stage is inflammation. During this stage, there's increased temperature, loss of function, redness, swelling, as you see here in that image, the first image. Second stage of healing is the proliferation stage. That's when the body starts to build a scar tissue. During this stage, there's actually a cascade of event. Scar tissue, which the technical term for it is fibrosis. Fascia restrictions, muscle spasm trigger points. That's happened internally. So final stage is the maturation stage. That's when the body is actually healed and everything clears up. That could take days, weeks, months, or years. So if you still have musculoskeletal issue, you either stuck in the proliferation stage, which indicated that you have scar tissue, fascia restriction, muscle spasm, or your body actually going back and forth between the inflammation and proliferation stage. And you can see it here in this image is like going back and forth between this vicious cycle of inflammation and proliferation. So if someone label you with sciatica or carpal tunnel or plantar fasciitis, you need to understand those labels are based on the most likely the location of the injury, but it does not give us a lot of information about what's going on internally. But by understanding the normal healing cycle, you really know you're stuck in either proliferation stage or you actually going back and forth between inflammation and proliferation. So how to actually address the root cause of the problem and influence the healing cycle to get to the maturation stage, which is clearing up everything. So because in the healing cycle there is a lot of several issue. It's like your car out of alignment or your car like need a tune-up. So there is a lot of little pieces that actually broken or a lot of little pieces that need to be changed. You cannot expect for recovery or getting to maturation stage if you just work on the fibrosis or scar tissue, or if you just work on fascia restriction and have not worked on the muscle spasm or the trigger points. That's why a lot of patients try different treatment, exercises, stretching, and based on the study, actually exercises and stretches will not break scar tissue or release fascia restriction. And actually, if you overstretch, you get cause inflammation and excuse me. So the goal is actually to address each aspect of the healing cycle. So to address the scar tissue, I have 2 tools to work on the scar tissue. The A3, this tool work on superficial scar tissue, and I use the A5 to release the deep scar tissue, and actually it work on the muscle spasm and trigger points. For the fascia restrictions, and I have several videos like explain each element of the healing cycle, but briefly now I'm just gonna go over the protocol on how to treat it at home. So for the fascia restriction, there are several layers of fascia. So we include in the patient toolkit the A1 to release the superficial fascia and the initial deep fascia restrictions. And for the deep fascia, very deep fascia restrictions, we use the A5. So if someone has inflammation, we have the MagnaHeal 1, we use that for mild inflammation. And for moderate to severe inflammation, when you have a chronic condition that your body going back and forth between inflammation and proliferation, like this image here. So I usually recommend the MagnaHeal 2 because it's wearable. You can wear it throughout the day, and you can sleep with it, walk with it, exercise with the MagnaHeal 2. So by understanding where you're stuck in the healing cycle, you really can get to the root cause of the problem. The main point is there is no one single tool that actually gonna break this vicious cycle or help to get to the maturation. You have to really clean up the entire system. You have to work on the scar tissue, fascia restrictions, muscle spasm, trigger points, and inflammation. So to simplify it, what we did is I created the patient toolkit. And the patient toolkit that actually has the the main four tools that work on inflammation and proliferation. So the patient toolkit, as you see in this image, it has the four tools. That's scar tissue, superficial and deep scar tissue, superficial and deep fascia restrictions, and the MagnaHeal 1. So if you have mild inflammation, we recommend or mild case, which you're pain around 3 out of 10, we recommend the patient toolkit, and it comes with one step-by-step program, which actually the same program that you're gonna go through with me in the clinic when you come and see me. I recorded these programs so you can do it at home. The only difference is that you are the one gonna do the manual therapy on yourself. But the program include how to use the tools. It include the exercises that you need to do afterward, behavior modification. It include the ergonomics, the posture, the body mechanics, to really get to the root cause of the problem naturally. So the second category we have, or the third one, is if you have moderate pain. If your pain level runs between 4 to 6 out of 10, we recommend the upgrade to a moderate pain package. And for this package, the difference between the moderate and the mild is replacing the MagnaHeal 1 with the MagnaHeal 2, because it's a stronger 2 to 3 times stronger than the MagnaHeal 1 and can be worn throughout the day. So, and it comes with the one self-treatment programs. You choose the one that you wish to treat. And lastly, if you are in severe pain and you actually really going back and forth between inflammation and proliferation, and your pain is 8 out of 10 or 7 to 10 out of 10, we recommend the severe pain package because it includes the anti-inflammatory supplements. These are supplements that, based on several studies, are very common deficiency for the patient who has severe inflammation, and that's the severe pain package. So I hope this is helpful. You can treat your pain at home. It's very easy to use the tools. I personally use it on myself. A lot of my patients, around 95% of my patients actually do the home self-treatment program, and they have a great outcome with it. So I will see you soon in the next video. If you have any question, you can leave a comment down below. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.